This is a video to demonstrate how to document some of the CMS 33 metrics in eClinicalWorks for Summa Health Systems NewHealth Collaborative. And what we'll see is that we can document these in ways that are both easily reportable and trackable, and also in ways that are not difficult for the end user. So let's look at the first metric here. Number of patients aged 65 and older discharged from an inpatient facility and seen within 60 days. So we need to capture the date of discharge. We also need to document that we're doing medication reconciliation using language that is recommended by CMS. So here I have some test patients set up. We're going to look at this first patient here. And I have set up a template over on the template tab as a favorite. So now this template will always show up in this tab when I open it. You can see it's listed here as ACO 12 inpatient medication reconciliation. So I'm going to load this template with the arrow. You can see how it fills in everything to the left in my progress note. I simply click on the underscored area, and it brings up a pick list, so I can pick the date of discharge from a facility. We'll say November 1st. I go to the next field, and then I can choose from one of these options to say if I've reconciled medications. Either I've kept everything the same or I've made a change. I click OK, and now it's documented this in the progress note in a structured format, so now we can search it and report upon it. And it's done it in a way that is not difficult for the end user. Let's go to our next measure, measure number 13, looking at fall risk for those 65 of age and older. So again, we're going to go up to a test patient. Once again, I've set up a template for this. ACO measure number 13, fall risk. Now you can see there are two templates here. There's one for exclusion of fall risk. That would be somebody that, for whatever reason, you do not need to screen for risk of a fall. But for the fall risk, I simply load the template, and here again I choose from the underscored area. They've had no falls, one fall, falls with injury, or so forth. So I'll say that they've had no falls. So you can see, very straightforward, very easy. Let's go to our another example. CMS 16, BMI screening and documentation of a care plan. So you can see that there are two sets of normal values here for patients depending on their age range. So for those 65 and older, above 30, and so forth. You can see the numbers right there. So here again, let's go to an example. In our test patient, I'm going to scroll to the bottom of the screen because this is going to be stored in the preventative medicine section. Once again, I go to my template. Here's a patient with an elevated BMI, and I'm going to counsel them in the office on diet and education. I'm not going to order a dietitian referral. I load my template, and here again it is stored the information in the progress note in a structured format. Think also too that for these patients in general, as we would counsel them, this was really 2 clicks. I clicked on the template tab, and then I loaded the template. 2 clicks to accurately document that I've counseled this patient on diet and education. This is a very efficient method of doing this. Measure number 17. Patients who were 18 years of age and older, screened for tobacco use, and who received counseling if they were identified as a tobacco user. So we'll go back up to our test patients. Once again, I'm gonna scroll down so we can see this better. Once again, I'm gonna go over here to the templates. Measure 17, screening for tobacco interventions. I'm gonna load this template, and here you can see that it's put in my ICD-9 code, and then put in under the counseling the changes that are recommended. Measure 18, screening for depression, ages 12 and above. This one is very straightforward. It uses the PHQ-2 screening. So here's this patient. Now once again, we have a template loaded here available to us. Depression screening, age 12 and over. Now if that depression screen is positive, there are other things we can do, other templates for this. If the patient is not appropriate to be screened, for example, maybe they already have depression or other reasons, you can exclude them with this. But here's the one we're just going to screen, and it loads in the PHQ-2 questionnaire. And we simply answer these questions. Note that if you answer yes, it'll automatically bring up the PHQ-9. And we save it. And now it's in our progress note. Just as a side note, another way to get to this, should you choose, is to go straight to the Smart Form field as a drop down and use those. Here's our next one. Those with CAD with an LDL greater than 100 have to document a care plan, which really should include prescription for a statin. So if we can go to our test patient, here we have a patient with an elevated LDL with a diagnosis of CAD. Once again, I'm going to go to my template list, scroll down, and here we say measure 32, coronary artery disease with an LDL greater than 100. We load this template. Once again, it documents my education that I've delivered to the patient, that I encourage them to get their LDL less than 100, and why I want them to do it through diet and exercise. And then we're going to repeat labs later on. It's documented all of this for us, which we would do anyhow, but it's done it in a very simple, straightforward way, and in a way that we can track it through the EMR. So I hope you see here that we've come up with a way of documenting these things in the EMR that's going to be both easy for the end user and also beneficial for the ACO. Thank you.